Hello, this is Sarfraz Niazi. I'm here with you for my new simplified update as to where we stand about the COVID-19. Few things. First of all, I want to share with you what happens when there's a pandemic discovered. Four things happen. First of all, we try to find out what is the antigen or what's the virus which is involved in a pandemic. That's a relatively easy thing. I think probably takes a few days, no more than that. And then a hunt begins around, is there a drug available that can kill it? I can assure you there were hundreds and thousands of companies and scientists working to figure out if there is a drug available, and none was found. The remdesivir, which is approved by FDA for use for hospitalized patients, simply reduces the hospitalization. It has no effect on survival otherwise. So at this moment, if you ask me, there is no drug that can be used to treat or alleviate the COVID-19 symptoms. And then the hunt begins for a vaccine, which is really the only real solution. By the way, for a vaccine to be effective in preventing or stopping a pandemic, 40% of the population must be immunized. Keep that number in mind, which is billions. Most of them can't even afford to have the vaccine. So while we have a good opportunity to have a vaccine, that may or may not be the final solution. One of the brightest things that might happen in the aftermath of the COVID is approval of an RNA vaccine. FDA has never approved it. Now there are several products which are in advanced stage of development. In my opinion, if RNA vaccines become acceptable, we would have conquered some huge challenges in the future of any type of infection that is viral based. We can even have new influenza vaccines. The good thing is that these vaccines are extremely inexpensive, very quick to manufacture, and they can be instantly developed almost. So if there was a bright light in the aftermath, that will be it. I'm sure you have all heard of what a rebound or the second wave. South Korea is getting back into locking down. There are many other places around the world, and in US, there is a second spikes coming in every country, every state. I was asked a very simple question: why US has such high incidence and how many deaths in USA? So I'll give you an answer. You're not going to like it, but I will tell you anyway. US has 4% of all population, and we have more than 1/3 of all deaths around the world. That's around 9 times. So if you're an American, your chances of dying of COVID are 9 times the average around the world. Why is like that? Despite the fact that if you do go to a hospital, your chances of survival are much better than anywhere in the world. At least we have a better care, if I can say that. Not a lot, but I think at least 20-30% better care. So what is it that causing this huge rise in the COVID cases? I will call it a Second Amendment issue. I have seen people making fun of others wearing masks, people claiming this is the Second Amendment right to go and infect others, people carrying guns to kill the virus. We are a crazy country. I think people just don't understand that Second Amendment does not give you a right to kill others. Now comes this question about the second wave. I said it before and I'm going to repeat it one more time as loudly as I can. The virus can enter through your eyes just as effectively as it enters through your nose. So if you're wearing a mask, you will not be able to infect others. But whether you're wearing a mask or not, you can still get infected if your eyes are not covered. Now try to figure this one out. I'm I'm telling you the exact CDC recommendation. How many people you have seen who are covering their eyes when they go out? I haven't seen any. So here we are, okay. We are taking the refuge in the mask, but we are not removing the risk to any significant extent. I still predict that there will be a huge second wave of COVID patients in US, and this will come at the worst time possible. This will come during the fall season or perhaps during the winter. The vaccine, in all likelihood, no matter how you push it, is not going to be here this year. I hope it comes next year. But keep in mind, this is the first time a new type of vaccine is approved. Can there be some huge hazards in it? Possible. So we should be ready for when the trial goes on a bigger scale and not just close the issue. With those few words, I want to tell you to stay safe. Do not listen to people who think it is okay to go out, take your mask off, and you start running to the bars and having all the fun with your friends. No, if you're not done with it yet, okay? Not at all. And I want you to stay safe. And if you want to take care of your loved ones, be inside and protect yourself, your eyes, as well as your mask, your mouth. Well, thank you very much for listening to me.